refer to the public guardian's office that are LPS designated, and there are some out in the community that either rarely do it or never do it. We've had that conversation around lack of beds, lack of the fact they're not getting paid. We've told you some of the reasons behind it. But I know that Dr. Ruiz has got a plan to be working with some of those, so maybe she can talk to you about her plan to work with some of these hospitals as under her authority with iCare, the ICD division.
So what we've looked at with Connie's help is that we're looking at what are the hospitals that are not routinely taking advantage of their ability to place persons that should be on a hold and should be on conservatorship. And what we're going to do is take a look at those hospitals, go and visit some of them, do a presentation with them and see if their behavior changes. Because it's clear that, especially in some particularly forthright cases, they've made commentary that the reason that they're not doing it is not purely for clinical reasons.
Financial.
Yeah.
So, that being said, we're going to do some training with these hospitals and see if that training has any impact on their behavior.
What's the consequence if they still say it's still lie? Do they have any consequence?
Well, I mean, that would be the next step, right? So the first step is training them and seeing if that impact has any, or if that has any impact on their behavior. But we have to take the first step first and then see if we apply any other sort of pressure on them afterwards.
What would the pressure
The
be?
citation. To lie to the people, that's like important.
Well, I mean, it's definitely not behavior that hasn't gone unnoticed. Let me just leave it at that. I mean,
I believe them that they don't appreciate it.
They take advantage of that ignorance.
There's
You
no
don't know that they're
regulation saying that they
supposed to
have
do
to.
it. They take
That's what
advantage.
is that what you're saying?
all know. And
There's
you know
no law or anything
Yeah.
to say that they have to provide that service.
So we're referring to a conservatorship, so let me just say that. They're designated to do involuntary treatment. They're not designated to specifically refer for conservatorship. They're designated, and their capacity is that they have the ability to involuntarily hold someone on a 5150, 5250, and a 5270. How that occurs is, and a referral coming to the public guardian's office is a clinical decision. There's no regulation that says a hospital who detains someone must refer to conservatorship. That, the law doesn't say that.
But if
The law
that's-
says that it's a clinical determination, and I think that's what Dr. Ruiz was getting at, that they're not always making the decisions based on a clinical, and they need to be making the clinical decision whether or not somebody should be even detained. I mean, that, even going from a 5150 to a 5250 is their clinical determination. Only a court could just, through a certification could overrule that. But there's no law that says just because they're designated, they have to refer.
But if the family asks them, they can tell you that we can initiate, but we don't think your loved one has the clinical.
That's what they should be
But
saying.
not live,
But that's
not
what they should be
live.
saying,
Lie?
yeah.
I am so frustrated.
That's what they
Well,
should
I'm
be
gonna
saying.
write to this hospital and I'm gonna complain.
But what we need in order to provide appropriate oversight and guidance is if they're making commentary. For example, the person that I work with is Linda Stone, correct? If they make commentary, because they're not gonna make the commentary to me, or I haven't heard the commentary yet, but if they make commentary to Linda, for example, that, well, I would conserve, but it's not a fiscally responsible decision for me to make, or I can't make that decision for fiscal reasons, that's not a clinical decision, that's inappropriate, right? That's just, not appropriate, because the decision should be a clinical decision. then that's when we need to step in.
Dr. Ruiz, we get that a lot, where the hospitals will give you all this, the person has to jump through hoops in order for them to do the LPS. And, you know, like, well, they haven't been at this hospital long enough, you know, enough times. What is enough times? And where does it say it in the law? The law only says gravely disabled and mentally ill, that's it. They will say, if we conserve, Mission Hospital has told many parents, if we conserved, we would go out of business. Lawson Seniors has said that too. We don't conserve except in rare cases and when a person has private insurance. These are statements that we are getting. We're getting statements that are not of the law. Now, why can't we get the DA to go after these facilities? Because they're not following the law. And that's why I tell people, keep a journal. Who do you speak to and what do they say? Because these hospitals have released patients and in a few hours those patients are dead. And that to me is devastating and totally unacceptable. But yet we're getting it time and time again. Now I know when Dr. Shaner was there, he would call the hospitals and he would, I know he couldn't make them do the LPS, but he would sure as hell put a lot of pressure and push them. And therefore they would do it. But it's almost like it's hands off with these hospitals lately.
Yeah, like my brother was released from the Lama on a Thursday, and Saturday he was admitted because he told someone, I'm gonna buy a gun and do myself. In 2 days.
In 2 days.
And they held him for 72 hours. He was back at the Lama and they released him again.
That to me is unacceptable. That should be, I know hospitals and doctors are not held liable when they discharge a person. But just as the conservator is not held liable, if your son stole the keys to the car and took the car and had an accident, you're not liable. But if you gave him the keys and these hospitals are giving them their freedom without the level, and the law does say, the hospitals are to seek the level of treatment that these people need for their recovery, and they're not doing that, and that's why I have a
So he was readmitted to the same hospital, which are
No,
different hospital?
he went back to, it's a county hospital, Harbor, but they never have enough beds. The 3 times he went to Harvard, they didn't have enough beds, they transferred him to the Lamo. The Lamo is the worst hospital we have ever dealt in the last 20 years. One of the doctors told my sister, you have to accept he's gonna be mentally ill for the rest of his life, and he's not gonna recover. A psychiatrist.
That's not.
So I think letting, Dr. Ruiz's office know of these situations, they can start to look into those situations.
Yeah, I mean,
One of my sisters wrote a
Can we let her
complaint
talk?
to the management of the hospital.
Call Dr.
Dr. Ruiz is with the
office. Yeah, do that.
They didn't-
I came to this meeting by sheer coincidence, and I've been suffering for a year and a half. My kid has been in 3 different hospitals, and the last dismissal, I didn't know anything about conservatorship. All the interactions with the hospital, with the social workers, with the doctors, with the nurses, were completely surreal to me as the parent of this 23-year-old. I was always pushed back because they are of age, and my kid has been thrashing for a year, and I feel I have no say and no rights, and all throughout this time, I resent that the hospital did not send my kid home with the proper means to really have a recovery. They did not send us home with the proper means. And that's unfair to me as a parent, that's unfair to my kid as a patient, that's unfair to society as a whole, and I don't understand. This was wrestling.
so, I mean, thank you first of all for letting me know. Second of all, I mean, so one of the things that Dr. Sharon has done is, in the last 2-3 weeks, is released a public bed shortage report. So have you heard about the bed shortage report?
Yes.
Yeah, okay. So you just told them about it. So one of the things that was noted in the bed shortage report is, and I apologize if you've already heard about this, but, is that the recidivism data shows that the national rate of recidivism, meaning, how often somebody comes back to the hospital after they've been released, the national rate is 20%. What do you think the rate is in LA?
Probably higher.
In my experience, I believe it's really high.
50.
It's like 50%.
Yeah, it's like 40%, so it's twice the national average. So in merging, the managed care unit and countywide resource management, we now track that, and we're going to track that. And we'll be able to see who are the hospitals that are releasing people over and over and over again so that they come back, and who's not doing appropriate discharge planning. And that's one of the things that we're gonna be looking at.
I'm
And,
gonna give you the information.
and thank you, Maggie.
Yeah.
Yeah, thank you, that's what I was about to say. If we can, sort of pair or marry, data with actual, person stories, that makes it much more powerful.
Yeah.
There's only a few people here, this happens a lot.
Yeah, it just happened, my brother was in Los Encinas, he was referred there from the VA because they didn't have a bed, but they did wanna put him on the hold. So they sent him to Los Encinas, he was there for 5 days, they released him, he wasn't well, he was still psychotic. So the VA picked him up the next day and took him back to their facility, and there he stayed for another 3 weeks. They, Los Encinas let him out after 5 days with no aftercare plan, nothing whatsoever. And they were gonna turn him out into the streets after telling me prior to his release that they would call when he was supposed to be released, and either I could pick him up or they'd provide transportation. They didn't call, and they weren't gonna provide any transportation for him because he told them, oh, I know where I am and I can get home. He's 20 miles away from home, he has no money, and they wouldn't order any transportation for him because he said he didn't need it. And here this person is psychotic, and they're listening to him, and they were just gonna turn him out. I just fortunately happened to call to speak to the social worker, and I find all this out. And I said, well, you were supposed to call me prior to his release and let me know what was happening. Oh, well, they gave me some lousy excuse. And I said, well, why aren't you providing transportation home for him? He lives 20 miles away. They said, he told us he didn't need it. I said, well, how is he gonna get home? He doesn't have any money, he doesn't know where he is. He thought he was in Beverly Hills, but he was in Pasadena. And you're listening to this person? And he wasn't ready to be released. When I called the VA the following day, they talked to him and agreed, and they came out, picked him up, and found a bed for him at their facility where he remained for another 3 weeks. So it was completely unacceptable the way his case was handled by Los Encinas. I could report that to somebody.
I think we all probably have at least a handful of stories like that, so it might be good to capture those in an email or, I don't know how, Amanda, you may get 10 million phone calls, so I'm not sure that's the way you want this. But, somehow to maybe, or through Gail could capture some of these stories and put them all together in one packet for Amanda, and that might be the good way to go forward at this point.
Yeah, I would agree with that.
Okay.
Is it something that NAMI could organize and do kind of a forum for these stories that talks about the release plan and what problems might it have had, or with recidivism, as you say, or the impact on families, right? We just heard of someone who had to quit their job. I've had a great impact on my ability to do things. I have a kid who now has depression because they see their sibling like this, so the forum could have many questions about the impact on the family, the release plan, and the danger that release plan puts the
I
patient
think the
in.
critical stuff will be around the release plan, and that, I think that's probably the critical information, right?
By law, the hospitals are supposed to, they send a patient home. They're supposed to have the family or whoever's taking them to sign that they are going to provide for their food, clothing, and shelter. That is the law. I have never seen that taking place, but I've seen
Right.
mental health treatment put in place. And that's very frustrating. Our hospitals will, the big thing they do, their release plan is, here's a token, go to a shelter. To the point that they even gave it to a legally blind young lady to go to a shelter. She couldn't navigate anything. So they are doing these, but we will help you out with your list. And drown you in it. You won't appreciate it.
Well, and I
but-
think the other thing to know too is that I know that the city attorney has taken improper discharges to, very seriously and has filed suits against a few hospitals. So there have been some, activity by the city attorney.
Yeah, you can call Mike Fuhr's office and they have a division you can report it to. Mike Fuhr, he's a city attorney.
Los Angeles city attorney, Mike
Do you have
Fuhr.
his number?
Just go onto the city.
You just go on the web, just city attorney,
Los Angeles website and look city attorney and you'll get that
and then,
link there.
and just ask for hospital.
Not the DA, city attorney for Los Angeles, not the DA.
One question for you is
Wait.
that I know that there's been a lot of mental hospitals, mental facilities in California that have closed
Correct?
in recent years. So if we turn against hospitals that need these facilities, right, that might not be the best thing. So when you were saying, we're gonna try to do training so that they understand that better.
I so appreciate that you brought that forward because, I think we, it's a balance, right? We don't wanna lose the beds that we have. So if you ask for an ultimatum, at the very end of the spectrum would be they wouldn't have designation and they wouldn't be able to involuntarily detain. I don't think that's where anybody wants this to go. We
No.
want to encourage, we want to train and encourage and have the resources available so that hospitals can make good clinical decisions. If there's not, you can open the front door, but if you don't have a back door and a place to go, that makes opening the front door very difficult. And I know Dr. Sharon is that's a critical point for him. That's what the mental health shortage board report is all about. This is the gaps. This is what's needed in the system. And in actuality, if you read that report, if the other beds are created, probably at the initial point needing a lot of subacute, but maybe that's not the long term that we'll need in creating the whole spectrum. We actually have enough acute beds in the county if we have the other levels of care. We don't need more acute beds, we need more